On September 1st, 1996, these are the injuries I suffered as a result of the robbery, assault, and the status of each injury with WSIB as of today. The first area of injury was gunshot wounds that I received to my body. The lion's share of it, although the wounds were to my thighs, legs, groin, stomach, and chest, my left leg received the lion's share of the damage and was ripped up pretty bad. Although I was able to build back on the strength of the leg, the issue I was having with the leg was severe and chronic cramping, both at the lower part of the left leg and at the kneecap. 6 months after I had a large piece of the bullet fragment removed from my lower leg, alleviating some of the cramping, but the knee was deemed inoperable as there were too many pieces in the knee and they were too small to determine which were causing the damage. Surgeon's diagnosis was that the knee cramping was nerve damage and the condition would worsen over time. WSIB awarded 2% NEL award for the leg 2 weeks after the surgery, and prior to any WSIB assessment, where an injured worker, me, might have had the opportunity to diagram the scope of the injury to my left knee. I have continued to appeal this decision, and to date the kneecap has never been considered for redetermination, despite surgeon diagnosis and prognosis, record of treatments and therapies, and consistency of complaint. A lot of these appeals on all of the issues I'm about to cover have taken over 8 years. One thing I've covered over 16 years, a number of appeals, over 8 of them. And one thing I wanted to clarify was in Sarah's letter that I'd been before the tribunal. As every injured worker knows, that'd be like catching lightning in a bottle. The appeals were merely based on the decisions that WSIB had made. I had never been to a tribunal. The next area of issue was the teeth. The assailant managed to crush in 3 of my bottom teeth during the assault, which were replaced with which were removed and a partial put in. WSIB originally denied this claim, forcing me to go through my private insurance company and paying 25% out of pocket to have this procedure done. Neck. This has been my most grievous injury and the one that WSIB continues not to recognize in its significance of the injury. And this is what the injury that's really been the one that's hampered my ability to maintain consistent employ. The injury caused severe neck and back shoulder spasms. The assailant attempted to break my neck after I had been shot. WSIB, through the mandated assessment, which minimized the injury and based it on a mild tissue tear on the neck, and that was the basis on which a NEL award was adjudicated. And there's been no redetermination from then to today on the neck, despite new medical evidence, which include a diagnosis of disc damage from a specialist, a diagnosis of disc damage from the surgeon who performed the 4 nerve block injections, and an MRI identifying damage C3, C4, C5, C6, and C7 with spurring and compression issues. And as most recently, I've been diagnosed with severe compression on the right side, which has caused a numbing on the right side of my right hand and the right 2 fingers, with about 50% loss of strength and endurance. My shoulders. I sustained injuries to both shoulders during the assault and the struggle with the assailant. The issues include loss in range of motion as well as loss in strength. The WSIB mandated assessment dismissed the injuries, citing there was nothing wrong with my shoulders. Years later, when I went and had acquired the MRI from the States, the MRI had shown that the right shoulder has damaged rotary cup with 50% tear in the right shoulder, and the left shoulder has a damaged rotary cup with a partial tendon tear in the left shoulder. Awards and redeterminations had been changed for the issue of the shoulders. In that assessment, apparently, I met a doctor that could read an MRI. On appeals, during the course of my appeals, and I'm sure every injured worker has probably come across this, but often I was being offered a 60-day expedited process, and then that process would end or terminate and not be followed through. And the reason for that is that on a 60-day appeal, it's based on MMR, maximum medical recovery. My injury has been diagnosed as chronic and deteriorating. It'll always be a moving target. And if I was to wait for MMR, it's like waiting for all the planets to align. It's just not going to happen. And my frustration with W.S.I.B. is make a decision today, not how I'm going to be a year from now or 2 years from now. Other issues I've had involving W.S.I.B., and you can provide feedback, check off the column and let me know how you did on these issues. Is there a apparent default to denial position? Interfering with medically ascribed treatments and therapies from medical professionals. Not delivering timely service. Lack of disclosure, not preparing injured workers for assessments, and I'll cover that a little later on. Lack of transparency, not advising the injured workers of benefits and entitlements. Knell and fell. Failed commitments, commitments that you have at meetings with W.S.I.B. that are not followed through. And then flawed and punitive Knell adjudications and the inconsistency in the appeal process. I have sent a letter to W.S.I.B. citing 32 instances in which W.S.I.B. failed to provide duty of care. Their position is nothing to see here. Let's move forward. And then what I want to ask is exactly what is reasonable. And to take a metaphor, you're provided a cabin with a lake to feed from. And this lake is a bureaucratic lake, so you don't have any option but to feed out of that lake. And the first 12 fish you pull out of there are tainted. So then someone comes over and says, well, let's move you to a different part of the lake, a different level of the bureaucracy. And the next 12 fish you pull out, well, they're tainted. So then he comes out and he pulls you to a different area of the lake, a different level of the bureaucracy, and the next 12 fish you pull out, well, they're all tainted too. Now, with all of their assurances of moving forward, they can guarantee nothing. But even an idiot like myself has figured out by now that the truest definition of insanity would be to continue fishing out of that same lake and expect different results. Because the problem is not with the lake, with the fish, it's with the bureaucratic lake you're fishing in. And there has to be a reason for this, for all of the obstacles that an injured worker faces. It can't just all be mere incompetence. If you go to WSIB's website and you get past all the diatribe policies and procedures, they really break down their vision statement to 4 simple principles. What WSIB is mandated to do, what their intent is. Number 1 is to promote health and safety in the workplace. Number 2 is facilitate return to work and recovery of patients. Number 3 is facilitate LMR, labor market reentry. And number 4 is provide compensation and benefits to workers. My largest frustration with WSIB was that although I made their obligation to me less complicated, they still could not deliver from early on. Out of all those 4 points I've discussed, they didn't have to promote health and safety at the workplace to me. They could have done it to the guy, with the guy that shot me, but not to me. They didn't have to facilitate the return to work for me. I went back 10 days after. They didn't have to facilitate a labor market reentry for me. I went back to work 10 days later. And providing compensation and benefits, I wasn't interested at that point. What I wanted was to return to work. All they had to do, and they could not deliver, they couldn't deliver facilitating the recovery of a patient. Now, without getting into much detail, my decision to return to work 10 days after the assault was based on personal and family reasons. I thought it would bring some normality to our life. And at that point, the only thing I needed was for them to help with my recovery, so that I can maintain my employ. And this is how it worked out. The first order of business was I could not eat because of crushed-in teeth, and they denied that as a pre-existing condition, forcing me to pay out of pocket and go through a private insurance carrier. The trauma had severe impact on me, I was having problems dealing with both the pain physically and mentally, and my family was having a hard time dealing with the issues as well. So I sought out a psychologist, and that was denied because I did not have a doctor's note. The combination of both denials sent me on a collision course with my employer, and asking them to ensure that I would not be out of pocket for any medical expenses that WSIB would not cover. Then what else did WSIB do? They interfered with prescribed therapies prescribed by medical professionals, forcing me to seek out pain medication for treatment. And that created a GERD issue, a stomach issue. And now I'm pretty well restricted from taking any pain medications. WSIB interfered with prescribed treatments by specialists and family doctors, forcing me to seek nerve block injections. And that ultimately complicated and further aggravated injuries for my neck and shoulder. Now, in a meeting, I had brought up those points with WSIB, and especially what the conditions that they both worsened and created in the GERD issue. And WSIB's response was that it was personal choice that I sought out pain medications, and it was personal choice that I sought out nerve block injections. But this is after they interfered with medically prescribed treatments by medical professionals. So saying it's personal choice, it's kind of like being on a ship and being walked out on a plank, but given the option of when you want to jump. I'm not sure that quite qualifies as personal choice. My position always has been WSIB not only failed to provide duty of care, as in their mandate, but their reckless behavior led to causing new injuries as well as aggravating the others, and fatally jeopardizing my opportunity at not only gainful employment, but quality of life as well. Now, in my intent letter to WSIB citing the 32 instances failing to provide duty of care, I recently received a reply from Brenda Abrams. She's from WSIB. She's the General Counsel, Vice President, Compliance Services Division, and Corporate Secretary. And in amongst all the diatribe was a sentence I found very curious in her letter. WSIB will vigorously oppose any claim for damages for anything that is alleged we have done or failed to do with regard to your claim. Such a strong word, vigorously, and used to describe their attack on an injured worker. Is it any wonder that the first impression an injured worker gets in dealing with WSIB is that of an adversarial nature, whether it comes from WSIB automatic default to deny position or in any other dealings? Now, in all of those instances can not only be validated by myself, but can be substantiated by WSIB themselves. I noticed she copied Elizabeth Whitmer in this. And Ms. Whitmer, you are receiving some very bad advice by bureaucrats who have been there way too long and only know one way of doing things. But how would Brenda Adams defend the indefensible? And why would Brenda Abrams defend the indefensible? Well, I can give you 205,049 reasons she would. You see, last year Brenda Abrams' paycheck for the year was over $205,000, and this money comes from the same fund that is meant to protect and support the injured worker. Obviously, you see the inherent conflict of interest. For her to acquiesce to an injured worker would be infringing on her own monetary interests. However, besides WSIB, there are a lot of surrounding interests that are also dipping their toes in the revenue meant to protect and support injured workers, which I will cover next.